I'm Dr. Jonathan Frank, an orthopedic sports medicine and joint preservation specialist. For patients who, as they get older, have developed significant osteoarthritis in their shoulder, and what that means is a shoulder that is painful when they first start moving, terrible at the end of the day since they've been using it a lot, and have been found to have wear and tear resulting in osteoarthritis that is pretty painful. When they're no longer a candidate for a minimally invasive arthroscopic procedure, there's something called a shoulder arthroplasty, which is a shoulder replacement procedure that they may be a candidate for. What that entails is removing the arthritic and painful surfaces in the shoulder and then replacing it with artificial parts that then allows it to function the same way a normal shoulder would have had it not been arthritic. A patient can now get back to having a pain-free lifestyle and be able to enjoy their life without really thinking, well, is this really going to hurt my shoulder? Am I not going to be able to do this and keep up with my friends or my kids or my loved ones? For patients with significant hip pain who have a well-preserved joint, in other words, not a lot of arthritis, they may have an underlying condition called femoral acetabular impingement, otherwise known as FAI. What that means is, as a result of having abnormal bony anatomy, they have an abnormal kinematic in the hip. In other words, they have an impingement between those two bones. With hip arthroscopy, which is a minimally invasive procedure, I can remove those bony areas that cause the impingement, as well as address the soft tissue structures, such as the labrum, that might be injured in this diagnosis. Hip arthroscopy is an outpatient procedure. In other words, patients come into the surgery center and I perform the procedure and they go home the same day. The next day, they go to rehab and have a very detail-oriented protocol for them to allow them to slowly get back to where they were before they started having their hip pain. This starts with range of motion and then leading to endurance, strength, and finally power and agility. What this means is that I can work with them step by step through their rehab process to make sure that they reach their time points in an appropriate fashion, but more importantly, get back to a pain-free hip that they don't think about and allows them to really get back to everything they want to do. A big part of how I treat patients is having a very detail-oriented rehabilitation plan. Whether that means trying to treat a patient conservatively and avoid surgery, or if they've already had their surgery, being able to get them back into motion and keeping them active is a big part of having a successful outcome and getting patients feeling like they're having a goal that they're able to obtain. What that means is working closely with a physical therapist that a patient is comfortable with and having either weekly or monthly notes and communications to make sure that a patient stays on track and is achieving the goals that they want to have as they get back to where they were before they were injured.